Foot doming. This exercise is recommended in subjects with functional hallux limiters, metatarsalgia, heel pain, pes planus or posterior tibialis dysfunction. The subject can start the first few exercise sessions in a seated position, and then they can progress into full weight bearing exercise as the muscles become stronger. So you can start by keeping your feet on the ground. You can lean forward so that most of your weight is on your forefoot. Keep your feet on the ground. Lift your middle arch up without twisting your ankle or crunching your toes. It's important that you try and keep your toes as straight as possible. The height in the arch raised need not be high. So you do 10 to 30 repetitions and you do 3 sets, repeat it 3 times. Start by standing on an even smooth surface with the heels and the forefoot together. Make sure that your body weight is evenly distributed between the forefoot and the heel throughout the exercise. You're going to press the big toe into the ground and then separate the forefoot, so you're moving it apart. Do 3 sets of 10 to 30 repetitions. Stand on an even smooth surface with the heels together and the forefoot apart approximately 6 to 10 centimeters. Ensure that the body weight remains evenly distributed between the forefoot and the heel throughout the exercise. Now press the outside of the foot firmly into the ground, then adduct the forefoot immediately towards each other. You need to do 3 sets of 10 to 30 repetitions. Heel raises. Stand with your forefoot slightly abducted or slightly apart, heels together and your toes slightly apart. To raise the heels off the ground, press all 10 digits into the floor. As you raise your heels off the ground, press them together in addition to pressing the digits into the floor. Athletes may do this exercise with a small weight. Now what you want to do is 3 sets of 10 to 30 repetitions. As you go up onto your tiptoes, hold it for a second. The minute you come down and your heel touches the ground, you want to go straight back up onto tiptoes again. Isometric toe flexion exercises. So what you need to do for this is to stand on one foot in front of a supporting wall. Use the wall to support you as you lean forward slightly to place your weight mainly on your forefoot. Force your toes into the floor, that's without crunching the toes, and hold the contraction for 10 seconds and then relax the toes. You want to repeat this exercise 15 times. And you do 3 sets of 15. This is single leg balance to improve joint proprioception. It's very effective at strengthening the intrinsic and extrinsic muscles of the feet. So you start by standing on one leg. And what you're going to do is circulate the knee, keeping the foot flat to the floor in one direction and then circulate in the opposite. Make sure you stabilise yourself on something, so hold on to something if you're not very stable. Single leg calf raises. So what we're going to do here is to find a wall or a chair to give you some support, and then what you're going to do is to lift one foot off the ground and balance on the other foot. Force the toes into the floor and push up until you are on your tiptoes. Gently lower yourself back down and make sure you kind of do that under control, and then repeat the exercise again. You repeat the exercise 10 to 15 times on each foot and you do 3 sets of 10 to 15 repetitions.